Hi there, my name's Blake Lovely, and I'm one of the recipients of the Tropical North Queensland Drought Hub Honours Scholarship for the year 2024. I want to talk today about my research project, which is titled Dealing with Extreme Weather, Community and Health Professional Perspectives. My research has been a qualitative study that has involved interviewing 14 mental health professionals across Australia, many of whom I've been lucky enough to secure from regional Queensland and rural areas of tropical North Queensland, which has provided some really great insights into my two key research aims. The first being to investigate mental health professional views on the mental health impacts of extreme weather events. And my second research aim has been to investigate the confidence and limitations of mental health professionals to provide this kind of support to these individuals, and also to build resilience in communities impacted by extreme weather events like prolonged drought. So my research findings essentially involved 6 key themes or topics which I identified. And these related to, firstly, my research aim about the impacts of extreme weather events on mental health. And my second, which was essentially encircling ideas around perceived competence and confidence of mental health professionals in these areas. So interestingly enough, my first two themes involved the mental health impacts of extreme weather events. And I gained this type of data through the semi-structured interviewing process of my 14 participants to really gain some valuable key findings. So the first idea that I uncovered was ideas around generational views. So participants identified that there was a clear differentiation between presenting concerns of clients from older and younger generations. So clients from younger generations tended to present with future-focused mental health concerns. These were deemed sort of eco-anxiety or climate anxiety relating to the environmental world of the future. And many older clients were identified as presenting with mental health symptoms of grief and trauma due to being directly exposed to these types of extreme weather events. Another key theme was to do with the location. So of course, many participants identified that those who hailed from regional areas of Australia presented with more pronounced psychological effects because of direct exposure to these events, whilst more inner city or metropolitan clients tended to have indirect exposure to these weather events and presented with a more generalized anxiety about the increasing prevalence of extreme weather events nationally. My last 3 themes that I uncovered were to do with the perceived confidence of mental health professionals working in this space. So firstly, I identified that nature of training and professional experiences was a key factor in perceived confidence of these professionals. So the need for further existence of these types of training resources or access to professional development in the extreme weather space and in the drought space was fundamental to ensuring that these practitioners felt confident in being able to treat these types of clients. Secondly, I found that there was a key theme around the approaches to treatment. So we found that those psychologists or mental health professionals who took a more transdiagnostic or human-focused approach to therapy felt most confident in treating these people because of the transferability of skills. Finally, I found that cross-cultural considerations were really important in this space. Most notably, it was identified that cross-cultural considerations were inherent to being able to confidently treat those impacted by extreme weather events, specifically in regional or rural locations such as Queensland. So many participants identified that there were unique communication skills that were required to properly understand the mechanics of these types of communities. This included such as professionals understanding the sort of prolonged socio-cultural impacts of extreme weather events in these communities, and also the nuances of how these types of events would impact agriculture or primary industries, as opposed to, for example, an inner city or metropolitan psychologist being transferred into a rural space and not having these types of skills, which are fundamental to confidence. So I'm really looking forward to taking these findings and putting them in a comprehensive honours research project moving forward.